Good morning, everyone, and welcome to our webinar on IPM performance for the month of May. Thank you, everyone, for joining us today on a weekend on a holiday. As we go ahead, before we start the presentation, let us look at what are the topics that will be getting covered today. First, in the last whole month or in the second half of the month of May, we used to get a lot of queries on what would be the impact of border tensions on pharma sales. So what we try to do is we try to do analyze the market and check if actually there has been any impact of these border tensions on the pharma sales across all states, particularly the northern states which lie on the India-Pakistan border. We also look at the Mounjaro sales update, how this market or how this brand is shaping up the market. Since monsoon season has almost arrived a little early this time, we look at therapies to look out for uptick as per the seasonality trends of the monsoon months. Later on, we look at our standard areas of the IPM therapy performance, the growth drivers, the top 40 corporates, brands, key takeaways. And we will also have a small introduction of our topic of the IPM Diaries episode 6, which will be conducted and released in the month of June. The first section, the impact of border tensions on the pharma sales. What we have done over here is, let us first discuss the approach that we have taken. So when we're talking about the approach, yeah. So when we talk about the approach, what we have done is we have evaluated the up and down taken sales seen in the month of May over the month of April. Then we have compared it with the trend lines for the last 3 years, because sometimes this year may not be an aberration, or this is the way it happens over every year in the month of May. And we have looked at the quantum of up or down tick in terms of percent variance and absolute values. So I'll just take you very slowly for North Zone so that we understand what is the methodology and how this approach has been used. So I've taken the sales trend right from the Jan 22. This would be the time when that COVID impact is also had started dying down. So from Jan 22 onwards, we have looked at how the sales trend has happened. And these are the latest months, April 25 and May 25. If you look in the states of North Zone, UP has shown a stagnation or a slight decline. Delhi, Haryana also a slight decline. Punjab, Chandigarh, Rajasthan also we are seeing a stagnation or a slight decline. So is it because there was a problem in sales availability or so? For that, we checked the trends. How did these months look even in the past 3 years? If you look at the past 3 years in this period, more or less, for majority of the states, there is either a very slight uptick or a stagnation. So this phenomena is probably a normal phenomena. To quantify these, we also looked at the percent variance. Now let us go through this table from this section onwards, okay, the last section. So what we have done is we have taken April 25 sales over March 25. So this is your month sales for the month of April. This is your sales for the month of March. So April over March, there is a 13% increase. Whereas over here, May over April is more or less a stagnation. So if you see typically over here, in the month of April over March, there is a significant double-digit increase in sales, whereas May over April, there is some amount of degrowth or some amount of stagnation. Should I dedicate it, or should I say that this is because of the border tensions? If I compare the same performance for last year, probably yes, because in the last year there has been a small uptick. However, if I look at the phenomena in 2023 or the phenomena in 2022, this is usually the way the sales happens. May over April, there is usually a slight decline or stagnation. So this type of sales or this type of phenomena, I would say it is something very normal. And to quantify it further in terms of absolute numbers, what we see is uh, the decline that we are seeing is a very small decline for a place like Uttar Pradesh. In Delhi and Haryana, probably the numbers may be slightly more. But if you look at these numbers against the value of the market, it is a sort of stagnation. The interesting piece that I would say in this table would be the incremental which UP has shown April over March 22, it is 126, here it is 144, and here it is almost 300 crores. Here it is almost 268 crores. So this uptick, which UP has shown in the last 2 years on April over March, has been significantly on a higher side. Next, we go to East Zone. East Zone, we have five states, Bihar and Jharkhand, Calcutta, Bengal Rest, Northeast and Orissa. Over here also, Bihar and Jharkhand is one state where we see a slight uptick, whereas in most of the other states, it has gone down. If you see how does the phenomena look in the last 3 years, if you see majority of the places, Bihar has always shown a slight uptick over the previous month, whereas the rest of the states either they have stagnated or there is a slight downtick in the last 3 years. If I were to look at absolute quantum, if you see over here, it is a 3%, 4%, 3% degrowth. Here it is slight 2% growth. Even in the past year, last year as well, there is a slight degrowth over the previous month. Over here, probably one or two states were a slight aberration, but a very slight aberration. But the month in 2022 as well, over over April 22, there has been a slight degrowth. So this trend that we are seeing for the month of May in East Zone is a very normal trend. Also in terms of quantum, if you see, again, for the player state of Bihar and Jharkhand, the incremental in 2022, April over March, was 25 crores, whereas this incremental has increased significantly in the month of in the year 2024 and in the year 2025. So this quantum is something which is significant. Otherwise, the trend of variance, positive variance or negative variance, which we are seeing in is zone, is more or less in line with what the picture looks every year in the month of May. Next, we go to West Zone. In West Zone, what has happened is Maharashtra, you will see it on a very, it's much above MP, Chhattisgarh and Gujarat, because over here we have clubbed Mumbai. Since we are doing this analysis at a state level, Mumbai we have clubbed in Maharashtra. Again, over here we see a slight downtick in Maharashtra. Usually it is either a slight uptick or a slight downtick or a stagnation. So it's not that we are showing a major variation. If you see in terms of growth for the state of Maharashtra, it is a slight degrowth of 1%. In MP Chhattisgarh, it is 3% growth, whereas in Gujarat, this would be one state which we would say that it's a border state and would have got significantly impacted. However, for the state of Gujarat as well, this trend, probably, last year there was a 1% growth over the previous month. But then in the previous years, in 2022 as well as 2023, there has always been a slight decline. In terms of absolute value, absolute numbers, if you see, there is not much variation. In Maharashtra, however, if you see the quantum uptick, in terms of absolute numbers, it is 121, which is significantly higher than what was seen same time last year. Next and the last zone, the South Zone, which is the biggest zone. In South Zone, we are seeing a slight uptick in majority of the states except Andhra Pradesh. And this is actually a usual phenomena. So it's not that only Andhra Pradesh has not done well only this month. It has declined only this month. If you see AP in the month of May, it usually declines slightly. Again, South state would be one state where, you will see things in green in the month of in the month of April, as well as in the month of May. In terms of absolute value as well, if you see, there is a significant uptick in the month of April as well as in the month of May. So net, if I were to summarize, because there were a lot of queries that were coming from the industry, from the media, from NPPA about will there be a shortage? Will the sales suffer because of all this phenomena? Not really. So if I were to just summarize how we can talk about this performance, if I just compare performance of May 25 over March and April 25, and if I compare it with 24 figures, we may perceive it as a stagnation or a downtick, because same time last year, there was a slight uptick in the month of May. However, if you compare the same with the 3-year trends, we realize that the up or down ticks shown in the pharma sales at a state level are in line with the annual sales pattern. Also, the border tensions had eased out during the sales closing weeks of pharma industry for the month of May. That is probably the reason why we do not see any major impact. After this section, we move to the next section where we look at the interesting part of the Mounjaro sales update, because all of a sudden anti-obesity drugs and obesity market has become the talk of the town. So I thought that we keep on continuing tracking this market and check how the dynamics are changing. So if I were to look at Mounjaro, right now it's available in two strengths or getting prescribed in two strengths. The market today in terms of absolute value for the last cumulative value for the last 3 months, it's around 24 crore markets, and consumption of units, it's around 82,000 units. If you see, the interesting part is this section. While the 2.5 milligram injection strength in terms of quantity consumption seems to have, stagnated. It's the same quantity that we saw last month as well as this month, almost the same. Whereas if you see, look at the 5 milligram injection strength, this has almost tripled, or sorry, this has more than doubled over last month. So if I were to look at these graphs in terms of quantity, if I just look at the overall quantity, everything is moving up. Of course, we'll focus only on the quantity because value is again a function of quantity multiplied by MRP. But what we see over here is a slight stagnation. But in this month, this has gone up significantly. For understanding why this may be happening, we looked at the dosage form. So the initial dosage is 2.5 milligrams once a week for 4 weeks. And after 4 weeks, it is increased to 5 milligram dose. So when we are seeing this type of switch, it is essentially meaning that the patients are upgrading to a higher dose after 4 weeks and new patients are onboarding on lower dose. This is a simple way of looking at this phenomenon. So basically, existing patients, a good adherence seen, and new patients also getting onboarded well on this product. The next section that we look at is the therapies to look for uptake as per seasonality of the monsoon. So if you look at what we looked at, the acute segment, which is directly related to monsoon related ailments, most of the time, it picks up in the second half of each year. In this segment also, we have identified the therapy areas that pick up well from the monsoon months and the segments within each therapy that drive this growth. Again, this is depending upon of course, we know which are the ailments which increase, but then data and numbers give us an exact direction to what extent does the consumption increase. So what I have done over here is, for comparison purpose, I have taken only 2 quarters, April, May, June, July, August, September. Some amount of summer impact comes over here. But this year, monsoons have also set in a little early in the month of May itself in certain states. That's the reason I thought that let me look at both the quarters together. Whereas what I have done over here is I have taken all the quarters. So typically, if you look at the IPM quarterly trends, it is the second quarter and the third quarter where IPM goes down, and from fourth quarter it comes up. Sorry, it is the third and fourth quarter, which is the April, May, June, July, August, July, August, September, October, November, December, the monsoon and the winter months where the sales moves up and then it comes down. So what I have done is I have looked at all the therapy areas, which are the therapy areas which contribute to these ups and downs of the Indian pharma market. The ones which I have highlighted in green, the gastro, the anti-infectives, nutritionals, respiratory, pain analgesics, blood-related, ophthals, stomatologicals, and antimalarials. These are the segments which typically show this type of seasonal trend patterns, which collectively they accentuate these peaks of the Indian pharma market. What I have also done is I have seen for how much percent sales happens in these quarters. For example, if 100% of gastro sale, if I were to break down in which quarters does the sale increase, then close to 27% of the gastro category sales happens in July, August, September. So what I have highlighted over here in green are the quarters where the contribution of those quarters is 27% or more. So I have looked at the historical trend as well as the latest what has happened in the last year as well. So historically, we are seeing that these are the therapy areas which are the typical high selling monsoon therapy areas. Now, it's a total overall number of 27%. However, if you go to the segments within these, there will be certain segments where the contribution would be 30%, 40% or so. So we have selected a few segments within these green highlighted supergroups to identify what drives the growth of these segments. Obviously, once we identify what drives the growth of these segments, then the companies who are operating in those therapy areas would be the ones which would significantly pick up in the next 2 months. For example, in the gastro segment, if you see the antacids, the laxatives, the probiotics, antidiarrheals, antispasmodics, hepatobiliary disorder products, these are the ones which pick up well. So basically, it is the infections, the waterborne diseases, the foodborne diseases, which increase significantly, leading to infections, leading to consumption of anti-infectives. Consumption of anti-infectives leads to increase in consumption of antacids as well. Also, diarrhea, dysentery, it actually pushes more consumption of probiotics. Again, there is a lot of awareness that is getting created in terms of probiotics. Even that is pushing the consumption of probiotics. This coupled with the disease pattern. Also, jaundice, which is a very common disease condition seen in the monsoon, even that consumption of those products also picks up significantly in the monsoon season. Coming to anti-infectives, it is mainly the antibacterial and the antifungals. Antibacterials majorly your cough and cold infections, and antifungals would be majorly your skin infections, staying in wet clothes, warmth of the body and wetness of the clothes leading to fungal infections. Nutritionals or the weakness created due to these waterborne, foodborne diseases leads to increased consumption of many of the nutraceutical preparations. Also, in the next category, what we see is the cough and cold market, a significant pickup seen in this July, August, September. Analgesics, pain and analgesics. So your bacterial infections, stomach infections, they are accompanied with a lot of pain. So analgesics also pick up. Rheumatoid arthritis, also we have seen a slight pickup in the monsoon month, because I think this is a condition which gradually starts picking up as the temperatures decline. In a place like Mumbai, probably we don't feel that, decline in temperature, but other states, other cities where the temperatures go down significantly, arthritis, the condition also exaggerates. Derma, typical conditions where your skin infections increase, hair care products, anti-allergics have shown a significant uptick. Anti-anemic preparations and plasma substitute or blood preparations also have see increased consumption in these months. What would I attribute white blood and plasma substitute solutions would be probably your malaria, dengue cases, which increase significantly. Also, anti-anemic. Anemia is a condition which is if you're weak, you're weak. You need to take anti-anemic preparations or hematinics, till the time you feel strong. But why probably these products pick up in these months would be when the patients get screened for dengue, malaria, blood tests get done, even the blood hemoglobin levels get calculated. Probably many of the patients get detected with low hemoglobins at that point of time, wherein along with the normal medications, the doctors also advise taking other nutrients, hematinics. Eye infections are the ones which increase significantly in this season. Mouth gels also we have seen there is an increase in consumption in the monsoon months, and malaria, of course, the disease which is definitely going to pick up, malaria, dengue in the month of monsoon months are the ones which show a significant uptick. So these are the acute category segments which show a significant upward tick, or which would be the segments to watch out for in the next 2 months, next 2 or 3 months. To summarize, the gastro, anti-infectives, nutritionals, cough and cold segment, pain analgesic segment, hematinics, ophthalmologicals, antimalarials are the key segments which will start showing an upward tick for the next quarter. These segments also happen to be the major bonus-driven segments. Three key elements play an important role in this season, driving the therapy growth for the companies which operate in this segment. First is the pull through the seasonal demand. Second is the push through schemes and campaigns. And third is the availability. So the demand for these products is going to be definitely there in the market. It's just how you leverage it, ensuring that you focus on your top line as well as bottom line. The next section, we come to our regular section of the IPM therapy performance. For the month of May, the IPM has really shown a very encouraging growth of close to 7.2%. Cardiac therapy among the top therapies is the one which shows a double-digit value growth. The unit growth also is quite encouraging for the cardiac therapy. Coming to the growth drivers, overall for the Indian pharma market, The growth drivers have been if you see, it is the new introductions and the price which is driving the growth of the market. If you still come to certain therapies, the cardiac and the anti-infective therapies would be the ones where the volume driven growth is also pretty strong. Coming to the top 40 corporates, the ones which I have highlighted in green color, Sun, Alchem, Torrent, DRL, and IPCA are the ones which show a very robust double-digit value growth, and MCure, which I have highlighted in blue color, shows a robust unit growth. This is for the top 10, 20 companies. For the next 20 companies, it is JB Chemicals, Laranon, Bayer, and Nutricia, will show a robust double-digit value growth, and Sanofi, Franco, Fords. These are the companies which show a robust double-digit unit growth. Coming to the top 40 brands, Augmentin and Glycomed GP, they sustain and maintain their rank at a MAT May number. However, interestingly, Glycomed GP moves to the number 1 position for the month of May, and PAN comes to the number 2 position for the month of May. Several brands have shown a double-digit value growth. PAN, Liu 52, PAN-D, Clavim, Zerodol SP, Thyronorm, Telma, Silacar, all of them have shown a very good double-digit growth, and a few of these brands have also shown a double-digit unit growth. Also, in the next set of products, Calpol has shown a double-digit unit growth, whereas Ribelsis and Vertine, they show a very robust double-digit value as well as unit growth. So to summarize for the IPM performance, the IPM has shown a very robust value growth of close to 7.2%. New introductions and price growth have driven the growth of the market for May 25. However, exceptions are anti-infectives and cardiac therapy, where the volume growth is pretty strong. For the month of May, majority of the top players have shown a very encouraging value growth. Augmentin and Glycomed GP, they continue to retain their leadership position at a MAT level. However, for the month, Glycomed GP moves to number 1 position and PAN moves to number 2 position for the month of May. Next section, we focus on the IPM diaries. IPM diaries is an initiative. We have really got a very good response from the industry. We focus on the strategic areas that drive exponential growth in the Indian pharma market. The very interesting topics that we have covered so far are the power of mother brand, strategic partnerships in the Indian pharma market, evolution of lifestyle diseases and how they have shaped the Indian pharma market, growth levers of the Indian healthcare industry, the Davids and the Goliaths of the pharma industry who collectively strengthen the Indian pharma market. The topic for this time that we have taken is the role of MNCs in driving the growth of the Indian pharma market. Because MNCs really, though in terms of absolute value, they may be small today for the Indian pharma market, but then they have brought to the country several innovations and models which make, in making the global treatment options available in the country and filling up the treatment gaps in critical disease areas. So a small example is earlier it was just SU meds which were used, SU meds and insulins were the only ones for diabetes treatment. DPP-4s and SGLT2s coming in the market have actually revolutionized the way treatment for diabetes gets executed, as well as the disease conditions in the country have also changed. So probably the existing therapy areas may not suffice to meet the needs or therapy needs of the patients. So there are over 30 MNCs that operate in the Indian pharma market today. Their value share in the IPM today may have shrunk to 15% from 22% in 2013. However, they have played a very crucial role in introducing many path-breaking therapies in India. In June 25 IPM Diaries, we will evaluate the interesting journey of MNCs in India that have not just supported the growth of Indian pharma market, but have also given an encouraging direction to treatment scope in critical diseases. We will be having this session this month on 19th June, that is Thursday. We will be sharing the link very soon. Kindly block your time for this webinar. It will be definitely a very interesting one. Thank you so much for joining. And in case you have missed any of the earlier sessions of IPM Diaries, please feel to reach out to me. We will definitely share this with you. We share the videos as well as the PPTs. If you come to our Pharma Rack LinkedIn site, everything has been uploaded on Pharma Rack LinkedIn site as well. Thank you so much for joining us today. It has been a great time meeting you today on a weekend, and have a really enjoy your weekend and have a very nice week ahead. Thank you so much.